Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hey everyone, today we're going to talk about Citalopram, an antidepressant that can be really helpful in feeling better. In this video, we'll give you a complete guide on how and when to use Citalopram. To begin, what is Citalopram? It's a medication used to treat depression and anxiety. Doctors often prescribe it to people who experience symptoms like constant sadness, loss of interest in activities they used to enjoy, or panic attacks. So how does it work? Citalopram belongs to a group of medications called SSRIs, which stands for Selective Serotonin Reuptake Inhibitor. Simply put, this medication increases serotonin levels in your brain, which can have a positive effect on your mood. Let's talk about dosage and how to take it. It's extremely important to always follow your doctor's instruction. Normally, you start with a low dose, like 20 milligrams a day, and it can be adjusted based on how you respond to the treatment. You take it once a day, and you can do it with or without food. Next, let's talk about side effects and precautions you should be aware of. Some of the most common side effects are nausea, fatigue, and sweating. In rare cases, it can cause suicidal thoughts, especially in young people. If you notice any symptoms that worry you, contact your doctor immediately. Finally, remember that citalopram can be very effective, but it's essential to use it correctly and be aware of the possible side effects. Always follow your doctor's instructions and don't hesitate to ask if you have any questions. I hope this information has been helpful. Take care and see you soon.
If you've made it this far, let us know in the comments why you're using this medicine.